cardiac glycosides have a role in HFrEF, let's talk about the brand new Digitoxin trial from ESC 2025. Cardiac glycosides have been utilized in heart failure as it acts as a positive inotrope and its effects on neurohormonal modulation. The DIG trial from 1997 demonstrated that digoxin reduced the heart failure hospitalization rate. However, the study was performed prior to the four pillars ICD and CRT therapy. The current study addressed the role of Digitoxin in advanced heart failure with NYHA class 3 or 4 symptoms or decreased EF. Treatment with Digitoxin was associated with a lower rate of the composite primary outcome of all-cause mortality or first hospitalization for heart failure at 3 years. However, these outcomes on their own were not significant. In the subgroup analysis, there was no difference in treatment based on NYHA class, AFib, triple or quadruple therapy. Additionally, in regards to their safety profile, about 5 versus 3% of patients had serious adverse events in Digitoxin and placebo respectively. In summary, Digitoxin was associated with superior outcomes compared to placebo. However, the results of the study should not be taken at face value. The primary endpoint barely met statistical significance, and a few events may have changed this. Plus, it was grossly underpowered as they enrolled just above half their calculated sample size, which further limits the analysis. Additionally, 20% of patients were taking SGLT2 inhibitors at baseline. Lastly, this was performed in Digitoxin, not digoxin, and the effects of digoxin will be revealed in the Decision trial. Current recommendations dictate that digoxin can be utilized in patients who are symptomatic despite GDMT to reduce hospitalizations.